Welcome, everybody. We're glad to have you here. I am Dr. Summer Kuba, and with me I have Dr. Carrie Bowles. And today we're going to be talking about mental health matters, navigating the terrain of K-12 education. And this is a 6-webinar series. And so with today's focus, we're hoping that you're going to gain a comprehensive understanding of the youth mental health crisis. And of course, we hope that you attend all 6 webinars, but they can stand alone, but it really is a dynamic series that we'd love for you to experience all 6 of those. And so the ultimate why behind this webinar series, our goal for students is overall academic success, but this comes with considerations. And as we know, one of those is mental health. And over the last 4 years, it seems as if there's been a push on not just identifying, but also treating mental health issues in schools. And many instances, we're seeing that this has taken precedent over some of our academic issues that we have in schools. And while we can't ignore mental health, we also can't ignore the academic decline that we're seeing across the nation. We're seeing increased behavioral issues, some school attendance concerns, social development declines, as well as emotional declines. And so according to this year's National Assessment of Education Progress, what we learned is that 70% of 8th graders were below proficient in reading and 72% were below proficient in math. Again, significant when you're thinking about what our K-12 education system is supposed to be solely focused on, which is academic. And so what you're going to see represented here in this visual has to do with funding. And we know that funding is important. And what we also know from the new executive orders that came into play is that funding will be cut in specific instances. And we're going to go over that a little bit later as well. But example is that in some states where funding is actually higher, the learning gaps have begun to close. And where those funding was less, we lost ground in improving some of those academic gains in reading and math. And again, this is going to be significant as we continue on with the webinar because there's been some things put in place in those executive orders that could potentially impact funding for our K-12 schools. And so again, just to stress, there's been a decline in 8th grade math. And what we know about that is those scores have been proven to predict both lifetime earnings and state future economic growth. And that's big. And so our overall goal here in each of these webinars that we're presenting in this series is academic success, but it also has to include mental health considerations, whether those are positive things or negative things, and we're going to look at what the contribution is to those. And so today, our hope is that you will gain an understanding about the history of mental health, be informed about recent statistics reported by various government agencies and organizations, learn about the impact youth mental health has on school climate, consider factors that are contributing to school climate, academics, attendance, and discipline, be informed of legal and ethical considerations as we move forward in this current political climate, discuss the impact that this new administration has on policies, and discuss future implications. And our ultimate goal is to protect and educate our students.
Thank you, Dr. Kuba. So this slide here, I just went back about just 10 years. And as you know, if you're in education, a lot happens in even just 1 year. So this is just going back 10 years. So the statistics show that school violence was about 39% of schools reported at least one incident without a weapon, but then you have 9% reported that there were threats with a weapon. Substance abuse in schools, 25% of schools report at least one incident of the possession of it, use of it, distribution of it. And 13% of schools reported at least one incident of this with alcohol, 10% with other drugs like prescription drugs. Moving on to some bullying, 22% of middle schools reported that student bullying occurred at school daily or at least once a week. And 15% in the high schools, 8% also in the primary schools, and 27% reported cyberbullying among students daily or at least once a week. So looking at the academic impact, the national graduation rates was 84.1%. And that was an actual increase, though, for all racial and ethnic groups. So how does this impact our teachers? This was 10 years ago. So 10 years ago, we had our teachers, 89% of them said that they had been enthusiastic about teaching when they started the profession, but only 15% reported being still enthusiastic when they completed the survey. Again, this was 10 years ago. And so the factors, again, same thing of stress and burnout, were some of the behavior challenges, bureaucracy, workload, paperwork, a higher responsibility for others in their care, a lack of autonomy in their classroom, lack of professional influence over the school policy. So teachers felt like 10 years ago, they didn't have a lot of say in the policies. And then also there's a gap between that pre-service training and then what was actually expected in the actual workplace. And then one of the big ones is that compassion fatigue or vicarious traumatization, which we're going to talk about in just a minute. So again, still sticking with that 10 years ago, 78% reported feeling physically and emotionally exhausted by the end of the day. If I have any teachers listening, you can probably relate to that. And then 10% of the teachers left after 1 year, and 17% left within 5 years. And although it's 10% and 17%, when you have good teachers, you want 0% leaving. And what are the negative impacts that they've had on students, the leaving? Decreased student academics, decreased effective learning, decreased motivation, negative impacts on the student stress level. So imagine teachers are telling us this 10 years ago, and this issue was not just limited to the new teachers. Many teachers experienced that they left because they were unable to deal with, the myriad of expectations that they had. And so the National Child Traumatic Stress Network, any professional who works directly with traumatized children is at risk of secondary traumatic stress. And so although compassion fatigue is traditionally being discussed as a secondary for counselors only, we're seeing that 10 years ago, our teachers were having this impacted on them because they work closely with youth who have experienced these adverse childhood experiences. So one of the things before summer talks, I did want to just share about why we thought, if we knew that the stats in 2015, why, if teachers were telling us this 15 years ago, I'm wondering, we need to ask ourselves, why was the answer to add mental health education to the list of teacher job duties? We want to make sure that when we're talking about this webinar, that being aware of these issues is not the same as gathering and documenting mental health of our students. It is not the same as adding teaching mental health curriculum to an academic focused teacher's workload. So again, if teachers were telling us this 10 years ago, we are seeing a trend today that instead of taking that risk of vicarious trauma off our teachers, we're actually seeing a trend of adding activities to their workload that's going to increase that vicarious trauma. So I wanted just to make sure that we hit that before Dr. Kuba goes on to current statistics.
Thank you, Dr. Bowles. So what we're looking at now in the current statistics findings, which is 23-24, talks about school violence, and the number of violent incidents increased more than 300% from the first year of the data collection in this research. So in 2016 and 17 to 23-24 school year, 300%. Substance abuse among grades 8 to 12 increased 30 to 45% alcohol, 11 to 23 nicotine, 8 to 20% cannabis. And then obviously you can read those statistics, but each of those, illicit drug use has gone up. When you're looking at bullying, we've got 28% of middle school students, 15% of high school students, and 10% of elementary school students reported the occurrence of bullying at least once a week. And about 37% of middle schools reported the occurrence at least once a week, followed by 20% of high school students and 6% of elementary students. Academically, 40% of public school students were behind a grade level at the start of the 24-25 school year in at least one academic subject, and 98% of public schools reported that at least some students were behind grade level in math and English or language arts. Mental health statistics, 71% of public school leaders reported being concerned about the mental health of their students, and 40% of public schools reported hearing concerns from parents about their child's mental health. And then again, Dr. Bowles talked a little bit about how teachers were leaving the profession. And so we're seeing some significant teacher shortages. So nearly 9 in 10 schools are struggling to hire qualified teachers. 23-24 school year, 80% of districts had trouble filling open positions. Estimates suggest that 55,000 vacant positions and 270,000 underqualified positions were there in 2024. And globally, there's a shortage of 44 million teachers. And we're going to even talk a little bit more because these statistics are specifically for teachers, but we're also looking at shortages of mental health professionals in schools. And while we want our academics to be the main priority, there are instances where these mental health issues do need to be addressed. And we're going to talk more about what that is actually supposed to look like, because as Dr. Bowles mentioned, teachers are being tasked with implementing curriculum that has to do with mental health when that is outside their scope of practice. And so all of these factors are contributing to what we're seeing here in academic declines and mental health.
So as one of the first things, that Dr. Kuba had shared is mental health is an important factor in our schools, but because of really the push, it seems like we are really overlooking some other factors that we as, educational professionals, we can assist with. So the first one, hopefully you're getting, exactly what I'm about to say, cell phones, and talking about how cell phones can negatively impact learning because they're a major distraction. And we've noticed some decreased, focus because of that instant gratification that our students are continually looking at some nutrition things. So there's a lot of individuals who they're naming, my student is having trouble staying awake. My student is having even behavior issues, grumpiness, and that's mental health. And we're finding, well, are they eating properly? Are they sleeping properly? Are they getting the correct amount of exercise? So again, these are things that we can change and make some impacts with. Social media, this is a huge one. Actually, just talking with some professionals last night about the impact of social media, that even if these issues, the cyberbullying and some other issues of social media are occurring outside of the school, it's being brought into the school day. And what's happening is our teachers, counselors, psychologists, principals, much of their time that's supposed to be spent educating is spent navigating social media, for lack of better word, drama during the school day. And so that's also a huge impact. Education policies, we know, as we mentioned, there have been some policies where either other stakeholders like teachers, parents, community members feel like they don't really have much weigh-in on those. That's another impact to learning. And then we talked about also one of the main ones is also where we have a whole section that we're going to talk about with this one is the lack of parental or guardian involvement. And so let me just read some of this. Lack of parental involvement leads to, and this has been researched, lower grades, reduced motivation, increased behavior problems, poor attendance, lower self-esteem, weaker social skills, decreased educational attainment, and that increased risk for dropout. So here we're seeing that there are a lot of other factors, and we are definitely, Dr. Kuba and I are both licensed counselors, so we are not suggesting at all that we're minimizing minimizing the effects of mental health on learning and education. There is absolutely research that shows that there is a direct impact. However, there are factors that we might be overlooking that also contribute to learning and education. And these additional factors can be addressed appropriately by school personnel. Factors that we can be addressed by principals, teachers, paraprofessionals, parents, where the mental health concerns should only be addressed by those individuals who have that specific qualification. And that includes the correct and appropriate education and the correct and appropriate licensure to do so. So we're just looking at how the impact, how we're overlooking a lot of those things is really impacting. So the main things that the school, what we're going to be looking at is school climate. How are these things impacting academic, attendance, behavior? When we are in a school, those are typically the big four that we really talk about. Why are we there? And so when we're talking about school climate, we're talking about really the idea of protecting and educate. And so protecting does include those physical protections like securing your buildings, like having emergency procedures. Emotionally, that should include anti-bullying policies and that supportive, school counseling and or others counseling related services. But again, that protected environment is crucial to learn. But those are the things we're looking at: protection and educating. Positive relationships. So that has to, of course, do with our teachers, with our parents, our communities, really that collaboration with our stakeholders. Talking about disciplinary policies. Students feel protected when there are discipline policies in place that are fair for all students, that are clearly, that they are communicated clearly, they are expected. And I've already talked about that community involvement. For the academic, now notice when I talk about the academic and attendance and behavior, there's going to be one thing I'm going to have us point out. But we know that there are many factors that affect or impact the academics. And so, yes, the motivation, the study habits, parental involvement, teacher quality. We just saw that the teacher quality, schools are having a difficult time finding even qualified individuals. Our school environment and peer influence. And then at the bottom, yes, health and well-being. But that is one of the factors that does not negate all of the ones that were before then. So moving on to that attendance, here we are looking at the same type of factors. The school climate that we just talked about. Is it a protected environment? Is it an environment that education is the focus? Are there parents involved? Attendance is also transportation. Do we have proper transportation for our students? Do we have the proper support? Do we have engaging curriculum? If our teachers are tasked with now also teaching mental health, there goes the engaging curriculum for the academics that were actually being assessed by our states at the end of each year. And then, of course, peer influence is part of that. And notice at the very bottom, health and well-being, yes, it does impact attendance. However, let's not forget about all the other factors that I just listed above. And then finally, I'm going to move to behavior. I think you guys are starting to see the point. They're all connected, aren't they? The school climate. Are our school policies and practices, are they clearly communicated? Are they implemented fairly across all students? Do we have those positive relationships? Are we looking at the socioeconomic challenges? Do we have our parental and guardian involvement? Is there the proper peer influences? And of course, it goes right from the top down, right? We all know it starts with our school board members that trickle down to our, superintendents. Our school board also has, complete say in a lot of things and working with our community. So it's really important that all of those things are also addressed. And then at the bottom, you see there, mental health. That is one of our factors that absolutely is and does impact behavior. We know this. However, we do not want to overshadow all of the other impacts that we are also seeing that we can as school professional that we can actually have a lot more influence over, and allowing the mental health to be really implemented by those that are qualified to do so.
Thank you, Dr. Bowles. And that really goes into some of these ethical considerations. Just going off of what Dr. Bowles said, is that ethical considerations is that we as professionals, and not just mental health professionals, but teachers as well as any other staff in the building, are providing services to students within their scope. And that's a huge ethical consideration, and something that needs to be considered right now. Because of how much mental health was a priority, there were those individuals that were implementing mental health services that were very much working outside of their scope. And that is a huge concern. And so the hope too, through this webinar and this series, is that you start to understand that and understand some of the impacts that that has had on our educational landscape as we see it. And then the hope to transition that back to where K-12 education needs to be. So when we're looking at ethical considerations, some of the things to consider here is confidentiality and privacy of student records. And so we need to make sure that we're protecting the rights of our parents, right? We have many situations where students are making decisions for themselves when they are not developmentally ready to do so. And some of parental decisions, information that's shared with parents, has been kept. And so moving back into letting parents be the parent who's the ultimate source for these kids, right? That is the person who should be able to make any and all decisions for them. Looking at equal access, fair access to services. So ensuring that all students, regardless background, diversity, socioeconomic, culture, are provided with the services that we need, and that are identified by those professionals that are qualified to do so, and to identify what those specific needs are. Professional boundaries, looking at dual relationships, avoiding relationships that can impair professional judgment or increase the risk of harm to students. For example, if you have someone providing services to a student, mental health services, and that again is not inside their scope, you are looking at doing harm unintentionally, obviously. I don't think anyone's out to intentionally harm students, but it happens unintentionally. And again, stressing that professional competence, and ensuring that our teachers, anyone in the school building, is adequately trained and qualified to provide the services that they offer to our kids and to the families. So looking then at some of these, some more legal considerations, looking at compliance with federal and state laws. And as we know, the president is working to put education back in the state's hand, which can really impact some of the policies that are currently in place. But IDEA and Section 504, we know, has been pretty consistent over numerous years. And so just making sure that we are providing the services that our students need based on disability. No one is taking that piece away. Making sure that FERPA is maintained, that we're complying with the Family Education Rights and Privacy Act to protect the privacy of student education records, and what that looks like in regards to parental involvement. Parents should have the ultimate say, be given the opportunity to give consent for all services. I know in some school districts, we are seeing an opt-out form as opposed to an opt-in form, which is super concerning, because if the form is sent home, let's say in the child's backpack, and the parent doesn't see it, and therefore it's not signed, there are schools that are taking that as, oh, we get to implement whatever this service or whatever this program or curriculum is, because they didn't sign the paper saying that they didn't want to participate. And so looking at the impact that that also has had, and that students are given an opt-in to where these forms need to be signed and provided to schools before a child or before a student is put in any specific program providing any kind of mental health services or even academic services. PPRA, which is the Protection of Pupil Rights Amendment of 1978, sometimes known as the Hatch Amendment. We're just giving you kind of an overview of these legal considerations right now, because we do have a webinar that's going to dig much deeper into these. But PPRA is a law that was intended to protect the rights of students and parents in programs that were funded by the United States Department of Education, which again goes back to that opt-in or opt-out. Parents don't know about it, but they have designed their consent form in a fashion that doesn't allow them to provide that opt-in, and these services are providing anyway. That goes against protection of the pupil's rights. So these considerations require careful balancing to ensure that our students receive the support they need while respecting the parent rights here. We want to make sure that we're communicating all of that to our families and to our students as well. So as we transition a little bit here in this webinar to kind of the current state of education, this is a lot of new information that literally is coming out as we speak. And so we are not the experts in this, but just a bunch of the research that we've done even over the last few days, we're going to kind of give you an overview of what we've seen from the executive orders. And so there was an order put in place to end indoctrination strategies, which is what the president calls it, within 90 days. And so as of January 29th, 2025, that is when the president signed this executive order. And I'm going to go into just a little bit. And again, this is my understanding, mine and Dr. Bowles' understanding of it. But I know that education systems across the nation are digging into what this actually means and what this is going to look like for individual school districts. So without further ado here, we've got one of the things that's being addressed in this order is social transition. And so this concept has been promoted over the last few years and has really been a cause of confusion. Like, what is social transition? There is even speculation that it's caused depression in children, caused and created some mental health concerns because of the confusion that social transition creates. However, what we do know is the president declared that there are only two sexes, male and female, and just yesterday he signed an order stating that only biological women will participate in women's sports and vice versa. So again, we know that new things are coming about literally as we speak, day by day right now. And so those are some things that are impacting our education system right now. So going back to that social transition piece, and the definition that the government gave was it can include psychological or psychiatric counseling or treatment by a school counselor or other mental health provider, modifying a person's name or pronouns, calling a child non-binary, use of intimate facilities and accommodations such as bathrooms or locker rooms specifically designated for persons of the opposite sex, and participating in school athletic competitions or other extracurricular activities specifically designated for persons of the opposite sex. So social transition does not include that surgery or chemically altering of hormones. Social transition is more of the decisions that these individuals have made to change who they are socially. Another part of this order is the DEI, what we know as DEI, which is discriminatory equity ideology. And the president has ordered that any program that continues to promote DEI may lose that federal funding. And what did we talk about at the very beginning of the webinar was that funding is important also for student success or district success, is school climate, academic behavior improvement, all of those things that Dr. Bowles mentioned. So we know that funding can impact the overall success of our students. And so districts are at risk of losing funding should they not take a look at this DEI ideology and make changes. And so a few of the things that this order is doing is it's doing away with beliefs that an individual, by virtue of their race, color, sex, or national origin, is inherently racist, sexist, or oppressive. And again, there is a whole list of these if you dig into that order, which is listed in our references. So there's going to be some links here for you to look at. So I'm just touching on a few, but also doing away with an individual by virtue of individual's race, color, sex, or national origin bears responsibility for or should feel guilty because of actions committed in the past by other members of the same race, color, sex, or national origin when they played no part in that. An individual based on race, color, sex, or national origin should be discriminated against or receive adverse treatment to achieve diversity, equity, or inclusion. And then one that's really been kind of big on the news and in the agenda, especially when looking at the current plane and helicopter crash, was virtues such as merit, excellence, hard work, fairness, neutrality, objectivity, racial color blindness, or racist or sexist, or were created by members of a particular race, color, sex, or national origin to oppress members of another race, another color, sex, or national origin. And so the United States government is looking at these policies and has determined that they are currently harming what we know to be successful in the public education system. And then one of the last parts that I wanted to address specifically about this order was that they are requiring patriotic education. And basically what that looks like is, and it's listed here for you because I thought it was super important to address, that there's an accurate, honest, unifying, which I love that word, inspiring characterization of America's founding and foundational principles. There's a clear examination of how the U.S. has grown closer to its noble principles throughout history. The concept that commitment to America's aspirations is beneficial and justified, and the concept that celebration of America's greatness in history is proper. And so if you have been in the education system, you know some of the ideas that are being kind of disputed as not patriotic education grounded in these things would be CRT, right? And then this DEI ideology, and also the transitioning, the social transition type of things. And so looking at the curriculum, not just academic, but social and emotional curriculum as well, and how it addresses these things that the president has put back and or taken out of what education should be. And so overall, our goal here, and I think everybody on this webinar, our goal is to protect and educate, right? And so what we know about protecting, Dr. Bowles talked about, but it's those security measures. When we're talking about protection, these are the things that fall under protection. Physical security measures, controlled access, right? Checkpoints, visitation management, surveillance systems, making sure that we have up-to-date emergency preparations in place for schools based on any crisis situation. School resource officers being trained specifically in what it looks like to oversee the security and protection of our students, including cybersecurity, secure networking to make sure that our students are safe when they're out in this virtual world that we have. And then when we're looking at specific ways that we can educate, we want to make sure that we're providing innovative teaching strategies, engaging learning environments, differentiating instruction falls underneath that, making sure that we're tailoring our teaching methods to meet the diverse needs of our students. Flexible settings, technology integration, that's where our world is at right now, right? But also going back to providing and ensuring that our parents and guardians are involved in the overall education of our students. Securing community involvement as well, because we know that it takes many people to educate our students, but not forgetting that the parents are in the ultimate control of decisions over their children. and then making sure that we're integrating that patriotic education. Dr. Bowles, were you going to add something? I feel like you may be were.
I just want to thank you for explaining a lot of that that's just come, that has just come out. And I think that's one of the reasons why we're so excited about this webinar series is while today we're really giving you a lot of information and a lot that really each could be really broken down. And that's one of the major reasons why we want to encourage you to come back to the next, because we're going to be really digging into a lot of these factors individually. And we're also going to be talking to, to those professionals that are in those fields and providing some practical ways that we as, educators can make sure that we are looking at all of these different types of factors and digging into how they are really affecting, just the school climate and certainly the students' mental health. And again, it goes right back to academic success. But what we're doing is the next few, webinars, we're really going to be digging in to each of these specifically and separately. That way, this overview may feel, it could feel a little overwhelming. But when we really dig into each one is so imperative, so important. And I think we want to do, of course, we want to be able to educate and talk about these, but most importantly, we want to talk about, well, how can we apply this then? What do we need? What are practical ways that that's appropriate for us as educators? What can we be doing to actually implement some changes going beyond just talking about it? So I do want to encourage, just staying with us the next few weeks so we can be digging into these specifically.
Yeah, thank you, Dr. Bowles. What we want to make sure from you all is that you are gaining valuable information here to move forward and protect and educate our K-12 students. What's to come next week is we will be talking about roles and responsibilities of mental health professionals. And so it's not just going to be Dr. Bowles and I. We're actually going to have other professionals in the field, specifically mental health professionals, social workers, school psychologists, LPC, a licensed professional counselor, school counselors, behavioral specialists. And we're going to be talking to them about what their role looks like that they've been trained specifically to do. And then we're also going to address any of the concerns of maybe things that they've been asked to do that have been outside our scope. Because what we know under that, the slide, and I'll go back to it here really quick, under this protect and educate slide, this very last one under protect says mental health support. And so in order to protect our students, we need to make sure that those professionals that are providing mental health services are credentialed. And that, again, I know we keep stressing this, but that they are not providing services that are outside of their scope. And that is a big way that we can protect them. And so the focus next week will be on who those professionals are, what their roles are and what their roles aren't, and how that looks in the school system, and then what we can do to make sure that as stakeholders, right, in the education system, that we are doing everything that we can to advocate for those roles and advocate against the roles that are not appropriate for other individuals that meet the needs of students. So thank you so very much for attending. We're excited about this webinar. So thank you so much.